Good morning, everybody. Today we are going to review a little bit of everything, as the first slide says. So let's have a look on the lymphatic system, and let's recall what is about it, what it does, what it is, and why we should be interested in this system. So we know that the lymphatic system comes from, on an embryonic level, from the same type of cells that are making the venous system. And we see that it's one-way system in comparison to the cardiovascular system that is two ways, going and coming back from the tissues. What it is a complex network of vessels. We have initial lymph vessels that have a net-like structure, and they have no valves. They are responsible for forming the lymph fluid. The pre-collector vessels, the lymph collectors, that are more of a linear design, and they have valves, and they are primarily responsible for transporting lymph fluid, and the lymph nodes that are at the chemical station and the storage of the lymph. We know that the primary functions of the lymphatic system are two. One is defensive, connected to the immunitary system, and one is responsible for cleaning tissue and maintaining balance and the fluid on the body. So one is collecting literally the fluid from all over the body, and one is defending from infection and potential danger like dust and other elements we were saying. Okay, what it does: the lymphatic is part of our immune system and helps to deal with infection at the local level. They are responsible for cleaning the tissue and maintaining the balance of fluid in your body. Drains the connective tissue. So the function of the lymphatic system are production, maintenance, and distribution of lymph. So lymphocytes are produced in the red bone marrow. They are stored within the lymphoid glands, such as the spleen and the thymus. Lymphocytes respond to the presence of invading pathogens, such as bacteria, viruses, abnormal body cells, such as virus-infected cancer cells and foreign bacteria, and toxin produced by some bacteria. Lymphocytes attempt to eliminate these three threats or render them harmless through a combination of physical and chemical actions. Now, what are the other functions of the lymphatic system? Is returning fluid from the tissue, from the peripheral tissue, to the central system, to the heart. So in which way? Dumping all the content to the venous system before entering the heart. The return of the tissue fluids through the lymphatic system maintains normal blood volume, so it contributes to the blood volume, especially on the part of proteins and water itself, water content, and eliminates local variation in the composition of the interstitial fluid. The volume of flow is considerable in every human being, so around 3.6 liters per day, and breaking major lymphatic vessel can cause a rapid and potential fatal decline in the blood volume. We are talking about like the thoracic duct, something big. Distribution of hormones and nutrients are a waste product from the tissue and of origin and circulation. The substances are unable to enter the bloodstream directly, but may do so by the lymphatic vessels. For example, some substances that cannot go directly to the blood system, but they need to go to the lymphatic system first, are the lipids, absorbed by the digestive tract. Do not often enter in the bloodstream through the capillaries. They reach the bloodstream only after they have been traveled along the lymphatic vessels themselves. Now, another bit that I will talk with you is about the anatomy of the urinary system. We know that the kidneys are located behind the abdominal peritoneum, looking from the front view, and in front of the ribs 12 and 11 and 12, the floating ribs, and behind the vertebra, the third lumbar vertebra, so from T10, 11 to L3. We know that they are being shaped. We have one left and one right. We know that the one on the right is slightly lower for the presence of the liver in the front, that is quite big and occupies space. We know that they are connected by the arterial system to the renal artery, and the ureters can connect the kidneys to the bladder to bring the urine made into the kidneys to the bladder. Can be 25 to 35 centimeters long, and they carry urine from the kidneys to the bladder for exertion. The primary function of the urinary system is to help to maintain homeostasis, again, by controlling the volume and the composition of the blood. The kidney is essentially high pressure filtration system, reabsorbing what the blood needs to keep and eliminating the rest. The eliminated materials are collectively called urine. Urine consists of water, solids, toxic waste, ammonia, urea, and something else. So the volume of urine produced daily is between 1 to 2 liters, but depends on the blood pressure of the person. That because the higher is the blood pressure, the more is increased the filtration. The lower is the blood pressure, the lower is the filtration. The blood concentration, so how much there is a fluid intake from the patient. The temperature of the person, how the temperature, high temperature make people sweat more, so when you sweat more, you urinate less. And mental distress, mental state, because also that has a function in filtration. Now let's review for a second the nervous system. We know that the nervous system has mainly 3 functions. One is collecting information from the peripheral nervous system, having an integration of the information in the central nervous system, and giving out a motor output. We know that the central nervous system we can divide it in different level of organization. Of course, it works like a unit, but we do this different size to make it understandable for us. We have a central and peripheral nervous system. On the peripheral nervous system, we have the motor division and the sensory division. On the motor division, we have the somatic and the autonomic. And on the autonomic nervous system, we have the sympathetic and parasympathetic. So let's focus for a second on the somatic nervous system. The somatic nervous system transmits information from the central nervous system to the skeletal muscle and the glands through the motor or afferent nerves. The areas of the brain particularly concerned with the motor activity and the motor cortex in the cerebellum and the cerebrum. So we see in the image that the man has a hand on a flame, feels by the thermoreceptors so feeding information from the peripheral nervous system to the central nervous system about being too warm, too hot for the hand, integrate the information in the central nervous system, and pull out an information for the peripheral nervous system of motor, move the hand from the hot source. Okay? So the 3 functions that we were talking about. This branch is also called as the voluntary nervous system because many of its activities are under our conscious control. We can choose to move our limbs to tighten our posture muscle or to smile. We cannot choose to contract our arteries or control peristalsis in the digestive tract. This branch is also known as the voluntary nervous system because many of its activities are under our conscious control. We can choose to move our limbs to tighten our postural muscle or smile. We cannot choose to contract our arteries or control our digestive tract. So the somatic nervous system, soma is body, means body in Greek, feedbacks from the proprioceptors, our eyes, and to a small extent our skin, enables us to monitor and thus control, coordinate our activities. Learning new tasks and refining acquired skill is a process of forging new connection in the cerebral cortex. Once a task is learned, it is controlled primarily through the cerebellum. All the relaxation training uses this proprioceptus awareness to distinguish between the feelings of tension and the relaxation into the muscles to learn how to initiate relaxation. All the physical therapies are based on this principle. Now let's focus for a moment on the autonomic nervous system. So the autonomic nervous system controlled by the body's automatic function, breathing, circulation, digestion, and the automatic accommodation of the eyes to the light. These are all slow, involuntary processes, ones that happen automatically without our consciousness or awareness, There are specific autonomic centers in the brain and the spinal cord, including the hypothalamus, the reticular formation monitor, and regulated this process and transmit information to the smooth muscles and glands and the cardiac muscle.